The present flood of facts and misinformation about the COVID-19 global pandemic being disseminated side by side has the ability to affect the mental health of those who do not know how to cope with it. The virus, which is being purported as scary, has changed the way persons socialize, travel, and secure their livelihood, leaving room for worry and fear. When the news first broke of Ghana's first confirmed COVID-19 case a little over a week ago, many Guyanese went into panic mode by ensuring they weren't short of sanitization supplies, gloves, and masks. As a result, several supermarkets, even with jacked up prices, recorded high sales for these products, which to date are available at a scarce commodity. On Thursday, Nightly News spoke with Will Campbell, a counseling psychologist who underlined the importance of containing one's stress and anxiety levels during this tense season.
Stress is a killer, they say. It is something that it is a normal human response, by the way. But when it becomes overwhelming, it compromises our immune system. And so it makes our bodies less able to fight off disease, to fight off infection. And so it is important not to remain stress-free, but to manage our stress. Another thing that happens is it compromises our mental capacity. Too much stress makes us more susceptible to mental illnesses.
Campbell, who alluded to the global panic buying of toilet papers, described panic as crippling. According to him, panic allows one to be counterproductive, resulting in irrational responses to the virus. He advised that the following measures are oftentimes ideal in overpowering panic and anxiety.
Reassure ourselves that this is going to be okay. Half our population is not going to die. COVID-19 has a really low mortality rate, actually. Breathe in for 3 seconds, hold your breath for 3 seconds, and then gradually release that breath another 3 seconds. It helps you relax. In fact, if you try it, you'll actually feel yourself relaxing. So take deep breaths, relax, and talk yourself through it. Positive self-talk is another important element.
He opined that staying in tune with authorized news sources and adhering to the Ministry of Public Health's precautionary guidelines, coupled with positive vibes, are also paramount coping skills.
But when you're reading online, make sure that it is not some obscure source of information. So you want to stay connected with people who are positive people, not the kind who will tell you, well, okay, you got a cough, you're gonna dead, kind of. That's not what you want to hear at this time. So you need to stay connected with people who are reassuring, who are sensible, who are positive, because this is a stressful situation.
Campbell, who is also a lecturer at the University of Ghana, pointed out that some persons who habitually surf the internet daily with the aim of keeping abreast with the new approaches taken by countries to contain the virus or how high the death toll has risen are easily overwhelmed. The counseling psychologist recommends a social media break.
If you feel overwhelmed by all this information and all this news of people dying here and hospitals becoming, healthcare systems becoming overloaded and so on. If that is taking a toll on you mentally, you might want to take a social media break, because there is such a thing as too much information. And I think that by now most of us know all that we need to do, so we don't have to stay abreast anymore. We don't have to tune in every day to see what is the latest development. We know what we're supposed to do. We know what's going on. We could take a break.
Guyana has so far recorded 5 cases of the COVID-19 disease in 1 week, with 1 death. Temika Rodney reporting for HGP Nightly News.